Well, monkeypox, it started off in humans in Africa in the 1970s, but the virus pretty much stayed on that continent for decades.
But earlier this year, doctors say someone traveled with the virus between Africa and the UK. It started spreading across Europe and the rest of the world.
So this week, the very first case of monkeypox popped up in the Triad in Davidson County.
The individuals isolating and close contacts have been notified. The health department could not tell us more about the person because of patient privacy reasons. But the department did have this strong message for you.
This is not a cause for panic. This is not a sounding a red alarm. This is, hey, this has happened. This is here.
So if this is here, we all better learn exactly what it is and how to avoid it. At this point, almost everyone has seen that one terrifying picture of monkeypox, creating what looks like ulcers all over someone's hands. But according to the CDC, it could also look more like pimples or a blister, at least in the early stages, before taking over your whole body. Monkeypox is extremely rare, but is spreading. The World Health Organization says there are now more than 10,000 cases worldwide. The virus started in Africa and spread first to Europe, where most of the cases still are. But there's been about 1,000 cases in the United States so far.
The global outbreak of monkeypox is clearly unusual and concerning.
In the United States, so far most of the spread has been among gay men. But doctors stress
there's nothing particularly unique about the population that it's currently affecting, which is men who are gay, bisexual, or men who have sex with other men. Anyone can get monkeypox. It's just right now what we're seeing is circulation among this particular social network.
Monkeypox is nowhere near as contagious as COVID.
The RO number, which is its reproduction number, is still quite low at less than 1. By comparison, COVID, the Omicron family, is probably at about 10 or 11.
While the World Health Organization last week stopped short of calling the outbreak a global health emergency, officials insist it is still a threat.
The longer the virus circulates, the more it will extend its reach.
According to the CDC, there is no treatment approved specifically for monkeypox virus infections. It has to run its course. Monkeypox is rarely fatal. As of last week, 3 people had died from the virus. The vast majority survive, but the pox can result in lifelong scars. One other big inconvenience of getting monkeypox is that it's about basically 21 days or 3 weeks that you were contagious and you got to isolate from other people. It starts with lesions that develop on the tongue and in the mouth. On day 1 or 2 of that, you actually start to experience intense headaches, swollen lymph nodes, backaches, chills, fever, exhaustion, muscle pains, and a rash that starts to spread. First, it goes to your face, then down to your arms and your legs. At that point, the rash kind of looks sort of like a pimple. But by the time you get to day 6 or 7 here, well, that's when things start to get really ugly. Those big pus-filled bumps, the worst looking of all the photos we showed you. That will last for another week before finally scabbing over. At that point, then you have to wait 1 more week for all those scars to fall off before you're not contagious anymore. It is not a super serious sickness, but monkeypox is a long and painful process. To learn how we can all avoid catching the virus, I asked the Davidson County Health Department more about how the virus spreads.
It is only transmitted through, or primarily through that direct physical contact with somebody who has the rash, which includes open lesions or sores, things like that. So the amount of the population that may be affected is probably very small.
Could you tell if someone has monkeypox?
Not necessarily, not just by looking at them, no. And not everybody would have them on the same spots. Some of them may be on the face, they may be on other parts of the body as well.
Should we be worried about like shaking a stranger's hand when you meet them for the first time?
And not for monkeypox, no. COVID still is an issue, so that, yes. But for monkeypox, no. It's going to be a prolonged physical contact. We're talking about somebody that you're intimate with or in a relationship with. And there is also the contact with like linens or towels or clothing that has been worn by somebody that has an active case of monkeypox, and handling those. You want to practice good hand hygiene and things like that.
So there's no need to panic, but if someone is still worried, what is the best way to protect themselves?
No need to panic. If somebody's still concerned, maybe they have a rash that they've had for a while, talk with your healthcare provider. Most folks are not going to be impacted by this right now in any means.
So hopefully that allays your fears some. The chances of you getting monkeypox are pretty rare, but if you do pick it up, there is a vaccine to help protect you from getting a full-blown infection. There are actually 2 vaccines approved for use in the United States. There's an ample supply of one of them. That's ACAM 2000. But the CDC says this vaccine should not be used for people who have health conditions like a weakened immune system, skin conditions, or women who are pregnant, which leaves us with the second one. It's called Genius, which is in short supply. Activists like Honey Mahogany want to know why that is.
I don't know what else to say. We should have learned our lesson back then. We should have learned our lesson during COVID, and we should be applying those learned lessons now.
All right, so here's why they say we have such little supply of that one vaccine that is more useful to most people. It's only produced in Denmark. Since the outbreak started spreading, countries all over the world have been trying to get their hands on some of that vaccine. The U.S. has ordered some shipments, but it is taking factories overseas more time to catch up. Right now, the United States has about 72,000 doses for our whole country. 80 of those have been sent for use in the Triad. They are being stored at the Forsyth County Health Department. Now, leading to the next question, how do they decide who gets that vaccine? For starters, you can only get the shot if you think you've been exposed. Contact the health department and they will assess your risk level. So this vaccine will be very different than COVID, where you get it after exposure, not before. But health experts want you to know it does, in fact, work.
Another topic that we've been talking about a lot recently is rabies. And so I'm going to compare it there as a post-exposure. It's, after you've had that contact with somebody, hopefully getting this vaccine into your body and teaching your body quickly how to respond to it and fight it off.
So the bottom line is that your chances of catching monkeypox are pretty low, and there's treatment if you do.
This is not another COVID in the making, but monkeypox can still have some gross side effects, so it pays to know how to avoid this virus altogether.